Meanwhile, the Kenya Association of Private Hospitals is warning that it will stop engagement with the National Health Insurance Fund if the current contract, which expires on the 31st of this month, is not retained as is. The association's Secretary General, Dr. Timothy Olweny, says that the current proposals by NHIF are not acceptable and they will have no option but opt out.
Beginning February 1st, 2022, patients seeking services at private hospitals under NHIF might be forced to seek alternative means. This follows the expiry of the current contract on the 31st of this month. According to the Secretary General of the Kenya Association of Private Hospitals, Timothy Olweny, there was no agreement with NHIF on a new contract and that the proposals being presented were not favorable.
What we're saying is we will not have contracts. So it's not an issue of us even sending people away. It's just that we have not been empowered to provide service. Because without a contract, how am I going to invoice NHIF if I don't have a contract?
The private facilities now want the current contract extended while they engage in talks to resolve the stalemate. In the new proposals, NHIF had revised downwards the amount of money it pays for claims lodged, with dialysis and surgical services reduced to about 50%.
For example, for appendectomy, which is removal of the appendix. So in this particular case, for example, the doctor's fees alone should be 80,000. But NHIF in the new proposed rate is asking hospitals to do this surgical procedure at 40,000, which is include all the doctor's charges plus the hospital's charge.
Initially, NHIF would pay 9,500 shillings per dialysis session, an amount that has been revised to 6,500 shillings per session. The private hospitals say that the new charges would see them make losses if not reviewed through proper engagement.
First, what has happened is we sit down in advance of contracts expiring. We have a discussion. We are saying we are coming to the end of a contracting cycle. There's these changes we want to effect. They tell us their part. We tell them ours. We make adjustments, and then that's how we have been hammering out new contracts. This time, this has not happened, and we've been following up this from June last year.
The current contract had expired in June last year and was extended for another 7 months, a period that lapses on the 31st of January 2022. Nancy Okware, Easy Friday.